Children who have dental decay or dental disease, I mean, they're losing sleep at night because of pain, discomfort. They're not able to concentrate in school. What we're seeing is that when the children are coming to us at 3, it's too late. They're coming with disease in their mouth already. While we can change the environment at that age because we will work hard to do that, it's still difficult because that child's gonna have to undergo treatment that could have been totally preventable. We need to do better at educating earlier.
So we're telling parents, take your child to the dentist with the eruption of the first tooth, and they're then coming to us and saying, but there's no one in our community who will see my baby. So we realized we need to do something about that. We need to be educating our general dentists. When we do our PA Age 1 Connect the Dots course, we start out by giving them the big picture of what is the standard of care that we're trying to educate them about. And where did this whole Age 1 initiative begin? And it starts with the national recommendations that come down from all of those professional groups, like the American Dental Association. And the whole point of that is to be able to prevent decay from happening in the first place and to educate the parents. We encourage a knee-to-knee exam because that's the best way to actually manage a young child in terms of looking into their mouth. So if the parent is holding the child and the child is facing the parent, then that child's gonna feel more comfortable looking at the parent. And then the child lies down on the knees of the dental provider. The dental provider is looking down over the child's mouth, but the child's always seeing the parent there first.
It's actually really exciting to educate my peers, our colleagues, because for me, it's about inspiring others to want to be a part of this initiative. So in sharing my experiences with them and what we've seen, I think it's important because it makes them think, I want to be a part of this. I want to be able to make a difference also. The other aspect is working with the fearful children. I love getting a child who is terrified of the dentist through their visit. It makes me feel so great when I'm done, and I know that they're not going to be afraid to come back. So working with them younger, we establish a relationship with them younger. So the sooner we see them, the better it is for them, the better it is for them in the future when it comes to continuing their dental care.
By virtue of having the Dental Trade Alliance Foundation grant, we've been able to reach out to a broader audience, engage more dental providers in this initiative, and to change the paradigm in our state. It has attracted a lot of attention from other foundations and other health-related organizations that want to improve the health of young children and families. So we're going to sustain this work that we have started through the DTAF grant and leverage that through these other grants that we're getting.
Because we know if the kids have dental disease early on, if we don't change that oral environment, if we don't educate, they're going to continue to get cavities. And that's the statistics, they haven't changed. So we have to change that. We have to let parents know that just because your child had decay at 1, 2, 3 doesn't mean it has to stay that way. Let's educate you on how to change things so that we don't have this in the future.